Okay, thank you, and good afternoon, everybody, and welcome to the St. Louis Metropolitan Pandemic Task Force briefing. Uh, this is where we'll give our update on our COVID-19 data, and as I'm going to show you here in a couple of minutes, when we look at our data, our numbers are on the rise again, which is always concerning. So we continue to see a trend in the upward direction, and that's absolutely what we don't want to see. So what this translates into is that we have some accelerated transmission of the virus in the community. And then we have to do everything now to slow that down. Now, we know we're not going to eliminate spread until we have vaccine, but by each of us doing our part, wearing masks, staying 6 feet away from each other, we can keep the economy open and we can prevent others from getting sick. So let's get on to our data, and I know we have a number of media questions today. So again, this is our hospital admissions rolling data, rolling average data, as well as the counts. And so as you can see, the curve continues to bend upwards, which is what we don't want to see. So today we had 30 new admissions, which is the highest that we've seen since May 19th. So that's a considerable number of admissions. Our rolling 7-day average is back up to 21 after a slight drop yesterday. So this chart looks at admissions through April through today, and it has a lag of 2 days. These are, of course, COVID positive patients. And these numbers are really concerning because it means that not only are more people testing positive for the virus, but more people are getting sick and requiring hospitalizations. So remember, we need to keep these numbers low. We get very concerned when we're getting into those 20s and 30s, especially when we see a trend like this. So this isn't just an individual blip on the radar. This is definitely a trend. So we'll move on to our hospitalization data now. So our hospital data continues to show an increase as well. So this chart again represents our daily hospital census of our COVID positive patients only. Today's 7-day rolling average sits at 164, which is the highest it's been since June 13th. Some good news today, though. Our hospitalizations did fall from 177 yesterday to 171 today. So there is a bit of good news. Now let me show you the numbers for today. Again, we had 171 hospitalizations today of confirmed COVID patients. We have 41 confirmed COVID patients in our intensive care unit, and we have 25 confirmed COVID patients on ventilators. Those last two numbers have remained essentially flat from yesterday. Now let me update you on our suspected COVID patients. So again, these are patients where we're waiting to get a final result on their test. They do impact our hospital operations, though, because we still have to treat them as if they are COVID. And so the same personal protective equipment and the same precautions have to be taken. So we have 139 hospitalizations of suspected COVID patients today. We have 6 that are in the intensive care unit and 5 that are on ventilators. So amongst all of that, a little bit of good news as well. We had discharged 29 patients yesterday from our healthcare systems, bringing our cumulative total up to 3,053 patients. And again, this is thanks to our healthcare workers, and not just our healthcare workers, but all those who support the healthcare system. So I don't want them to get lost in the discussion as well. So there's people that clean the hospitals, cook the food, do all of those other things that we take for granted, but that help our healthcare professionals take care of patients. So special thank you to them. So to conclude today, the data are quite worrisome, particularly those 30 new admissions that we saw. And as I've said before, hospitalizations and admissions are a lagging metric. And so we suspected that once we saw a rise in cases, that the rise in admissions and hospitalizations would soon follow. And that's exactly what has happened. So even though those cases have primarily affected the younger populations, it's really a matter of time until the virus finds a susceptible host that needs to be hospitalized. So although this 30 is a single day's worth of data, as we've seen over the last week or so, we have been creeping up in our admissions, in our hospitalizations, and the rolling average bears that out as well. So the way to prevent this from continuing to rise is to decrease the spread in the community. and only the community can do that. So everyone has to do their part, and everyone has to take this pandemic seriously. So that includes things that we've been talking about for a couple of months now. Wearing masks out in public, limiting your distance between people, limiting the crowd sizes that you're around, washing your hands. All of those things decrease spread. And if we want to blunt the increase in cases that we're seeing in the hospital, if we don't want to have to roll back businesses opening and cutting down on crowd sizes again, or decreasing the capacity in restaurants, then we have to do these things, or else the cases will continue to rise. So it's up to all of us to slow the spread of the virus and keep our economy going, and even more importantly, to keep people out of the hospital and to save lives. Really, that's what this is all about. So we'll continue to watch the data. We'll continue to keep you updated on the trends that we're seeing. And now I'll turn over to questions from the media. Thank you.
When it comes to PPE, how are we doing, and are we starting to see shortages as other regions are reporting seeing?
As far as personal protective equipment goes, we seem to be doing okay right now. From the major healthcare systems, everybody believes that they are adequately supplied with personal protective equipment. So that's how we are right now, given the scenario that we're in right now. Obviously, anytime you're going to increase patients, you're also going to be putting a strain on the supplies. And so yet another reason why we need to blunt the increase in hospitalizations occurring. From the beginning of the pandemic, the supply chain has always been a challenge, and there continues to be challenges in that supply chain. What we're witnessing around the country is the dramatic surge in cases and people admitted to the hospitals. Everybody competes on a global market for personal protective equipment, and St. Louis is no different. So when you see cases increasing in other parts of the country, they are obviously going to attempt to buy more personal protective equipment out of that same pool, which then it's decreased for everybody else. This is exactly the reason why, not just here in St. Louis, but throughout the country, we need to do everything that we can to push those admissions down so that we can adequately protect our healthcare workers with personal protective equipment.
What are the age breakdowns of hospitalized patients?
Yeah, and so the age breakdown is, and we pulled this data together in anticipation of this question, so I'm going to show this to you right here. So the majority, as you can see, are over the age of 75. And so in looking at the percentages, the less than 18-year-olds is a very small fraction, so around 1%. From 18 to 50-year-olds, it's around 20%. From 50 to 65, it's around 27%. 65 to 75 is around 21%. And then greater than 75 is around 30%. And so as you've seen, or as we've spoken about, people that are older are a much higher risk for hospitalization, and this data really bears that out. Now, there are other things that contribute to admissions as well, so how healthy a person is, what sort of chronic conditions do they have. And so there's a lot of things that go into this data, but that's the generic breakdown that we've seen with ages and hospitalizations.
We have heard that in southern states where numbers are exploding, medical experts think it might have to do with people spending more time in close quarters inside with AC. Do you expect we may see a similar uptick?
It's certainly possible. So if you think about this from a probability of transmission, early on when we were doing shelter in place, people were staying in their homes as well. However, what is different is the shelter in place didn't allow people to move around as much. So people weren't gathering in homes or in other places, which increases the probability of spread. So it definitely does. Anytime you are congregating people within a closed space and you're not wearing masks, which people don't normally do at home, then you increase the probability of transmission. That, and people are going out into, the economy, going shopping, going to different places, and if we aren't practicing all of those things that we've spoken about, there's greater exposure there that they could bring back to the home as well. So it's certainly possible. Now, whether that translates into more cases, we don't know yet. But it certainly is one of the things that we need to consider.
Are there any concerns that this heat wave might impact coronavirus cases?
Separate from the previous question about the air conditioning, the heat wave in and of itself, it's hard to say how it's going to impact coronavirus. We know that UV light does impact the virus. How much it does, though, I think is still an open question. But regardless of what happens with the heat wave, if we can still continue to practice all of those things that we've been preaching, that's really the best deterrent. So it's the mask wearing, it's hand washing, it's social distancing. Regardless of what the weather is outside, we still need to be practicing those things.
And a follow-up to that, a lot of people in the age category where you said were in the hospital rely on cooling centers during temperatures like this. Are those populations are often at higher risk? Mm-hmm. What precautions should they be taking?
Same precautions that we've been talking about with everything else. And so you're absolutely right. The cooling centers are for people that don't have air conditioning in their homes. And so those are typically people from socioeconomic disadvantaged backgrounds. And so those are absolutely the people as well that are at higher risk for COVID admissions and testing positive. So the cooling centers need to follow the same sort of protocols that any other venue would do. Social distancing, mask wearing, hand washing, sanitizing, all of those different things in order to protect the people that are coming there to beat the heat.
While cases are going up, hospitalizations and deaths aren't changing as quickly. Why could that be? Does it indicate the virus isn't as dangerous? Is there more testing? Or is there a lag between test results and deaths? And should we expect to see fatalities increase proportionately in the near future to align with the case increases?
That's a long question. So I think as we showed you today, the hospitalization or the admissions are now starting to creep up, which is probably the follow-on from the increase in the cases that we've seen. It's difficult to say. So there's not a one-for-one, right? But we do know anytime there's increasing cases circulating in the community, there's increased virus in the community. And eventually, it's going to find a susceptible host that is going to become even more sick, require the hospital, possibly intensive care, all of those other things. And then, unfortunately, more people will die. It's a probability. And so with this increase in cases, we believe that's what we're seeing now, is the admissions are starting to catch up. Death from COVID is a lagging indicator, as the questioner said. The percentage of people that were turning positive were in a younger age bracket, so we'll have to continue following that to see if that then changes to a different age bracket. But many different things.
We have heard that many people are not getting their test results back for days or even weeks. Is this a common occurrence, and does the lag time give you concern?
We have heard from, especially from the national labs, that the turnaround time, which is a term we use, has been increasing over the past week or so. The reason for that is these labs that are contracted are national labs. Anytime there's an increase in the number of tests that are being performed around the country, it puts a stress on the capacity at those national labs. So they have reached their capacity where they have to slow down testing because they can only run so many tests at a time. So previously we could get test results, we being the general, we public health and other people, within a couple of days. We have heard that this has been stretched out to anywhere up to 10 days, which is concerning. We try and make our decisions on how we can best mitigate the virus based on the best evidence that we have. Evidence, of course, includes those case counts. When the case counts are delayed by a week, 10 days, then you're not operating off of the most timely intelligence that you have. So then you don't understand where you are with transmission in the community, which puts you further behind. So it's always concerning when we can't get data back as quickly as we need it to. The healthcare systems are a little bit different. We run our own micro labs, and so we're able to turn around our tests for people within the healthcare system, so patients that are admitted to the hospital, in a much more timely fashion. And so we rely on that as well as a sort of barometer to understand what's going on out in the community as well.
You spoke early on during the pandemic about the disparity in the Black community. At this juncture, how do you believe the region is doing in addressing those disparities?
So from a practical point of view, testing has definitely improved for the Black community, particularly through the federally qualified healthcare centers and through public health departments. And so that has ramped up considerably. So the testing strategy, being able to identify people, being able to quarantine, isolate, all of those things, contact tracing, has improved. But I think the broader question is the disparity question, and of course that's a result of years of social justice issues, economic disadvantage, and racism, and that has been decades in the making, and it's not going to be solved in a couple of months in a pandemic. As I've said before, the best way that we can, as a community, handle the pandemic is to make our community more resilient. And in order to do that, we have to work on all of these social issues. No amount of testing or hospital beds is going to make up for that.
According to information provided by Johns Hopkins University, communities like Nashville, Memphis, and Kansas City have simply not reported the death totals recorded here in St. Louis. Understanding you don't have the ability to offer scientific analysis of these disparities, do you have any beliefs at this time that we have not done enough at the onset of COVID-19 to prevent the loss of life?
No, I don't. I believe our elected leaders were very fast in identifying the issues and issuing the shelter-in-place orders, which without a doubt saved lives. Now, regarding the death rate within St. Louis compared to other similar-sized cities, I mean, we can make the same argument for other cities that have seen more deaths than St. Louis. That's a very tricky statistic to try and dissect just based off of a single data point. There's other things that go into this, such as the demographics of the city, the population density, the amount of chronic conditions that are in the population. All of these things play a role in mortality. And no two cities are the same. And so it's a very complex answer. But as far as the decisions the elected officials made, I think they made them at the right time and without question saved lives.
Hospitalizations in our area have increased significantly over the last 10 days. Do you believe the mask orders in the city and county were issued in time to stem this tide, and should they have been issued earlier?
Well, certainly the timing was not enough to stem the tide now that we're experiencing now. If you remember correctly, the orders were on July 3rd is when they started. So we know that the viral replication cycle, it'll take about 2 weeks for the mask order to have any effect. Taking policy decisions is always a challenging thing to do. You have to incorporate a lot of data to arrive at a best conclusion. I do think, though, that everybody that was involved in that discussion came together, looked at the data, and came to the right conclusion, which was issuing the mask policy for the city and the county. And I applaud them for that. It was the right thing to do at the right time. From a purely public health perspective, we should probably wear masks during every flu season. But I do think that they looked at the data correctly and came to the right conclusion.
That concludes the list of questions received from members of the media prior to and during the briefing. Thank you for tuning in.